Eastern
staff.
doctors.
Yeah.
Oh,
Yeah, they have, and so they were the ones that brought the acupuncture. I've had a few students that said they now give it as an elective course during the
wow.
medical training. They can take it if they want to. So I was saying, well, that's good. It's insane, but I mean, over there, acupuncture and saying for certain conditions, it's wonderful.
You mean the students, you mean in the med school? It's an
In the med
option
school.
to take it?
Yeah, they have an option. You get certain electives. You have to take certain courses, but
Right.
you have an option of electives, and that is one of the options, acupuncture course,
Oh, that's really interesting. Wow.
which is great,
Yeah, it is good.
and especially from U of M. It tends to be a little more conservative, but like I said, they have a high influx of doctors from the East and saying, hey, fantastic.
Yeah, yeah. Have you ever had acupuncture yourself?
No, not, you mean I picked myself, but I haven't out.
Yeah.
No.
No, I've never had it. I don't know anybody personally that's had it, but I know someone that knows someone, that kind of thing. But
a few years ago, we had an acupuncturist come to a Fibro meeting, and he asked for volunteer towards the end to show people what it was like. He had the equipment with him and the sterile thing, the needles, and I think he did like in here or something on me, just to show me what it felt like. And I really didn't feel it going in or anything. So I've never had a treatment though, besides that.
They're very, very, very thin needles.
Yes.
And saying in this little corner in here in your hand, that's another thing for headaches. You get headaches, it's a pressure point, and that's where I think they pick it up from the acupuncture point, pressure point. There's also we send people out for that want to quit smoking to a place. They do some laser tagging of your earlobe. That's supposed to help, which is another acupuncture can do that on the earlobe, stops the addiction to nicotine.
wow.
Yeah, I used to do, or when I was in my younger days, when I lived in Ann Arbor, I learned reflexology, which is some things that some of the local clinics do. And they believe that parts of your foot relate to parts of your body, and pressing on those parts is kind of like an acupressure thing. And I can see where it's all related, kind of like your spinal cord. It kind of goes to different parts of your body. And then there's also a thing on your ear. Some people do the treatments on the ear. I figure, what do you got to lose? Try something that it might help. You never know. So
that's good.
Well, they say everything's connected, so
it isn't. That's what we say when people ask us about they have something's going on in my eyes, and saying we call it the window to the body.
Yeah.
So you're looking in there and saying, yeah, but any kind of strange stress on the system is going to affect every other little tissue. I tell you, if you sprain your right ankle within a couple of days, your left hips hurt because you're walking differently, and you have to readjust and saying it's one thing hurts, something else balances. You're trying to do something like that and saying, it's going on. But we'll go back to the tears. Besides all the drops, the ointments, the water, the gels, and the nutritionals, which are really important. There's also one called Lacrocert. It's a very tiny little piece of plastic that dissolves in your lid. You put it in there in the morning, and it dissolves in about 18 hours. And it has moisturizers in it. So this, for the people that say, I can't put a drop in my eye all the time, I have to put drops in, this slowly dissolves over time. Now it's a little piece of cellulose that it's in with moisturizers in it. And saying, so I have a couple of people using those. I probably had about a 20% success rate. So, but some people swear by it and saying that's another way to go about it, which is good. Other thing that we use with what drops, again, we go back to the steroids. When we talked about allergies, we use that. When it gets to really bad, they have something called autologous serum. This is taking a pint of blood out of you. They spin it, get all the blood cells out, take the serum out. You take that to a compounding pharmacy. They put it in little bottles, and you put that in your eye. And that's your own blood serum they're putting in your eye. So it's completely safe. The only problem is that you have to keep it cold, and it only lasts about a month to 40 some days. And then you go to the next one, and they do it. So, and it's not cheap, and you have to use 8 to 10 drops a day for the rest of your life. I tell people, in a pinch, you're out someplace, it's really bad, wash your hands really good, prick your finger, and put a little drop of blood in your eye. And saying, I read an article about that, and I said, yeah, actually, that's not a bad idea, but just make sure you're clean, because your blood's sterile, and that's what they're using. So for the endpoint, for the people that fail everything else, we use the serum drops. You probably know that you've heard about Restasis or Zydra. Those are drops to try to stimulate your glands to do their job. So Restasis can take anywhere from 3 weeks to 6 months to work. You do have to use it twice a day, every day. But what it's trying to do is stimulate your own glands to do their job. One called Zydra, Jennifer Aniston advertises that. It works similarly. It's a little different drug. That one tends to work. Most people notice a difference within 2 to 3 weeks. And it just depends on your insurance, which one they pay for. There's a third one. It's very, very similar to Restasis, the same medication, cyclosporin, but it's a little higher in concentration, called Sequa. Now, Sequa's not paid through by insurance. You have to go to one of 2 pharmacies. We write a prescription, we call them up, and they call you, and you can use that. With some people, it's a little bit cheaper, but it tends to be a little bit stronger. I tend to still stay with the Restasis most of the time. Excuse me. Also, with any of those that you want to keep using that. We do have some people we have actually got down to just once a day, which isn't too bad doing that. Other things that, especially at night when people say they wake up in the morning, or the other masks, there are a litany of masks out there. You can get online. Sleeping masks. They have masks now that you can heat up and put on, and that helps with the blepharitis and helps to thin out the oils for meibomian gland dysfunction. For those meibomian glands are down. Someone said Bed Bath & Beyond has them. You can get them at Amazon. You can get them. There's lots of different kinds. Some have beads. Some are a little liquid in it. There's lots of different kinds. And saying, whichever one works. There's just so many of them out there now. Punctal plugs. That's another one. Plug up the puncta. The puncta is the opening to drain your tears in your eyelids. So the tear duct is actually the drainage tube. So your eye itself has glands to make it, but it has to go down there. And if that tube we get too much going out, we just plug it up. And saying for people that do not have enough water in their eye, close up the drainage and just let it evaporate. And saying that works pretty well. But we always want to make sure we have to do those other tests to make sure it's not inflammation causing it. Because if we plug up those glands and it's not total water, it's inflammation, all we're doing is we're keeping more inflammation in your eye. So that's another way to do that. And that's a little in-office procedure. I've actually put even some in people's eyes without any anesthesia. But normally I just numb the eye a little bit and push that little plug in there. We have bandaged contact lenses. So contact lenses that go in your eye and you keep it in your eye for 1 day or up to 30 days. And so now the front part of your eye is covered with a Band-Aid. It's a clear, non-prescription, so you can see through it. And it tends to hold some of the drops a little bit longer, a little better than what your eye can do. We'll do that. Again, sometimes the problem is trying to get insurances to pay for that one. Some do, some don't. If you've heard of something called scleral lenses. Now, these are contact lenses. These are more like the old hard, but with the newer material that breathes, but they're actually bigger than a soft lens. So the little gas perm lenses are probably about half the size of the color part of your eye. Soft lenses go out onto the white part. Scleral lenses go out even further. And they're kind of tough because they're bowl shaped. They're a bowl. And you fill this bowl up with water, you put your head down, you have to put it in straight up, because if you tip it, all the water flows out. So you got to get all this water in, you put it in there, and that fluid then stays, and you can wear it for 10, 12, 13 hours. And that keeps your eye nice and moist with all that fluid in there. And that's pretty new technique. It's been around about 3 years now, and we're treating some people with it. And the nice thing is we can put a prescription in it, and you can wear contacts with that too, which is good. Let's see, let's talk. Other devices that we've using, something called Blephex. And this is kind of like the Oral-B for your eyelashes. And it's it looks just like an electric toothbrush. And on it, it's not brushes, but there's very thin, small silicone little fingers that you rub right along their eyelid, and it stimulates the glands and it cleans off the lashes, both the top and bottom. The Blephex is done in office with that one. And those typically go for about $150 to $200 a session. Wow. You do both lids. There's probably about 10 of them you can buy online. They can go from $30 up to $200, but you have it at home, you do it at home. They're not quite the intensity that the Blephex is that we use, but they're fine. One's called Nulids, Nulids. And it's a home one. They say do it, 1 minute. The only thing with that is that costs about $300. And then you have to pay, you have to change the tip every day, and that's $1 per tip.
Wow.
To use. So that'll be, that runs the price up again with that. But then you can do it at home as necessary. Some people say you should do it every day. Some people say every other day. We don't have a whole lot of people that want to take a toothbrush to their eye. But again, it's not that harsh. It's tiny little silicone. Another way is Lipiflow. Lipiflow is a kind of, you think of it like this 1950s device, but it's a clamp that clamps on your eyelid. And the front part of it heats up to 108 degrees. The back part heats up to 108 degrees to melt the oils. The front part has a little pressure. And what it does after about 5 minutes, it starts pushing down, and it pushes down on the upper lid. It pushes up on the bottom lid to squeeze all those glands out, clean them out, and get all that oil out and let the fresh oil come in. Now that one used to be about $1,200 to $1,500 a session. I don't have that device here. I refer for that, and the doctor I go, he says it's about more like $700. Some people need 2 or 3 times before it starts to take effect, and you might need it once a year, not paid by insurance. That's out of pocket. Though it's incredible how many people have it and doing it, but the device is very expensive. I think like you use that device with the one that looks at the meibomian glands, and the two together run about $70,000. So that's why when they charge you $700 to $1,000 for each time, they're trying to pay off their machine that they bought. But it does work if you still have patent glands that are plugged up. But it's a special way of heating them. They now have other devices. There's one called an iLux thermal pulsation, and it's a little small device that goes on, and it does something very similar. It doesn't go under the lid, it's over the lid. But again, online, you can get some of these little things that go across. I've seen them as cheap as $35. I'm not sure how well they work. Not as good as what does in the office, but if you want to try something out for $35, then that's fine. There's a bunch of different ones. I don't know the brands. One of the newest things out there is called IPL, Intense Pulse Light. This is actually, dermatologists do this on a lot of people that want to get rid of sunspots. If you have rosacea, freckles, birthmarks, and they put this, you can do it across your face. Do that, but they found out that people that are having this done are no longer having dry eye. And so they've done some studies on it, and found out that, yeah, it does work. And it's not laser, because laser is one specific beam of light. Intense pulse light, the IPL, is a number of different wavelengths that go on, and it's a pulse of light that shoots. And what they do is when you do it for the eyes, they actually do cover your eye, so they don't put it right on your eye. Cover your eye because you don't want that light. It will absorb into pigmented tissue. It works best for lighter pigmented skin. I think the skin ratings go from 1 to 6, and this works from 1 to 3. Darker skin doesn't work as well with. They can lighten the skin, so they don't want to use it on darker skin because it'll cause blotches. But they've had problems where people have not put the pads on, and it's actually caused an iris to have infection. And some of these people, it's for life. They have problems. So they always put a little pad over your eye so it's not there, but it's still by doing down along your cheek and along your forehead. Sometimes they do this intense pulse light. It takes about 6 to 8 minutes. Those run from, it's about $300 to $400 a session. They said normally it's anywhere from 3 to 4 sessions spaced about a month apart. And then you might need a retreatment in 6 months to a year. The investment though for the doctors it's high. So I don't know of any doctors that have that. You can, if you have something on your skin, you can talk to your dermatologist and say, hey, you treat my skin, maybe my dry eye, I'll go away. And it might, and saying it. So that's how we kind of got that from them. It takes about 20 minutes. So, or anywhere from 8 to 10 minutes, 20 minutes for both eyes. That goes. Questions on that? Or I know I kind of went through it quick, but I was a whole bunch of different things and saying we've got a lot of things for treating the eye. For that now, new devices coming out with it's one of the biggest things in the industry besides nearsightedness. And prior to COVID, nearsightedness is pandemic on the planet, and that's because we're all up here all day long and saying. But as we become more mature, we're not as worried about that anymore.
So much.
I was going to ask you about the IPL. Is that for the Meibomian gland or what is that for?
Yeah, that'll be used. If you have meibomian gland dysfunction or blepharitis in the eyelashes, it can be used for both.
Is that what it's generally used for, or is it?
Generally, well, the IPL is generally used by dermatologists to treat rosacea, freckles, sunspots on the skin. Then the IPL, they can use any place in the body. But when they found out when they used it on their face below the eyes, and the eyes are always covered, they found out that a lot of those people got their blepharitis and dry eye went away.
Oh, okay. So
now we're starting to use it just for that.
Yeah. Well, then a dermatologist would do it on the eye also, or
Well, they'll do it. They do it on your skin.
Uh-huh.
But it's still it'll take care of the eye because again we put little pads to cover the eye. So there's plastic things. So we don't want any of this to get in the eye, because if we hit the iris, that's not good.
But then I've actually had it for rosacea on the face, but I don't know if they do it on the eye there, but it wouldn't. That's what I was saying. Wouldn't it be an eye doctor that just does?
The dermatologist can do it because again, it's on your cheek. It's on the area here. They're not touching your lid, the lashes or anything like that, because it's covered. So it is on the thing. But if for rosacea they do it, but it's one of the things for the eye. You're going to have it repeated. It's not going to last.
Oh, I see. Okay. Yeah, I didn't realize that. When you said the eye, I just thought it would have to be an eye doctor, but I guess not then. Okay, thank you.
We found out it from the dermatologists.
Okay.
Interesting.
Thank you, doctor, for all your information. As always, I did have one last question before we wrap up pretty soon. I noticed recently I had to go to my eye doctor because, I needed to get an eye exam and everything. And they told me, well, your eyes are starting to change and I have to get bifocals. So is that common? Because I'll be 38 next month, but I guess my eyes started to change before 40. Is that common for my age group?
And it is. And it depends on the amount of close work you're doing. I tell everyone that the person with the best ability to focus up close is age 10.
Oh.
It starts to decrease after age 10. So 10-year-old can see up this close to their eye. You're 20, you're like this, and 30, and it's going out. Now, any any kind of issue in the body is going to make it go even a little bit further. And so, but we don't, I tell people, we don't do bifocals here. We do multifunctional lenses. Doesn't that sound better? You know, it's multifunctional. So, okay, it's not grandma's bifocal. But that way. Now, on some people, especially in their late 30s, will use that Eisen lens that goes out and relaxes the eyes a little bit. And sometimes we've had success with that to delay the need for with the progressive or the type of bifocal.
Yeah, so these are my new bifocals, so
Yeah.
they work pretty good, but still.
Yeah, oh yeah, they work. They're just, it's so relaxing. You can look. Sometimes the problem with a progressive or a bifocal, if you're looking at a desktop computer, desktops are usually too high, and people are tipping their head up to try to get into it. Laptops, they're perfect for. I've never had anyone ever complain about their bifocals or progressives with a laptop. Desktops, just in the wrong position. You want to drop your desktop down a little bit so that you can look over it.
Okay.
It's a little easier on the eyes.
Interesting. Well, I just use a laptop, so I'm all set.
Yeah, and that laptops are wonderful. Yeah, no one complain. Nobody. It's interesting because people come in and complain about their desktops. No one complains about laptops. They don't complain about their phones anymore. Not even Surface Pros or tablets or anything. It's all desktops because of wrong position of where it's at. I said I don't know of anybody that grabs something and holds it out like this and reads it. You're normally going to put it down low. Well, that's exactly where the laptop is. You just put it in that way because when we focus our eyes, they automatically turn in and move down. That's how we're built as humans. And so you want to get your screen down just a little bit. Laptops are perfect.
Anybody else have any questions? Nope.
Okay.
Thank you so much for coming. Oh, I think Ron had a question.
Okay.
Any thoughts for dry eye after RK? I have like a dozen RK scars on each eye, give or take.
Yeah, with RK in dry eye, they've cut some of the vessels, and that is, I tell people we start out with over the counters. You know, I start out with the oils. I just jump right from the watery right up to the oils. If that's not working, sometimes we've had some success with some of the anti-allergies. Some people have had success with the Pataday now that it's over the counter, or Aloe that's over the counter, to add into it. Some people we do have to go to the Restasis and Zydra for to try to boost that up, or even some of the times the steroids. Anything you do to heat your eyes to get the glands to open, that's good. The thing with the RK is you've cut the nerves that signal tearing, and we're not getting enough tearing. So that's when we go to the Restasis and the Zydra to try to increase that basal tear rate. And saying, so it's not always the eyelids or lashes with the blepharitis or meibomian glands. It's just that the eye, there's no signal to tear because of all those nerves are cut. And that's true of LASIK also.
Oh, that's fancy. Thank you.
Okay. Anything else?
I think I'm all set. What about you, Cheryl or Mary Lou? Did you have any last minute questions?
Oh, I'm all set.
I'm all set too.
Thank you so
Thank you
much.
for having me.
It's a pleasure having you.
Joining us.
It's always great. Your questions are always fantastic. Thank you.
And be safe.
Everybody have a nice new year.
You too. I hope this virus will go away, doctor. When do you think it'll end, in your opinion?
Don't know. It's hopefully we're going to just live with it. It'll be like the Omicron. It's very contagious, but it's not as potent. And maybe we're just going to get down and reduce it to where it's like, hey, just get the flu shot and that's it. If you feel bad, just stay home a few days. And the nice thing is they have cut the quarantine time down from 10 days to 5 days. And saying, so hopefully that's good where it's going to go.
All right.
Thank you, doctor.
Well, thank you.
You're welcome.
Thank you.
Bye-bye.
Yeah, bye-bye.
Bye.
Bye. Have a good day.
Thank you.
Oh, I guess it's just us. So we have 15 minutes left. Do you guys just want to wrap up now, or what do you guys think?
Yeah, that would be fine with me.
Yeah,
Yeah,
that's okay.
Unless,
Good.
Anybody else has anything else to share?
Well, I think
Okay.
at our next meeting, I just want to let you guys know it's on the 27th. And we're going to have a hypnosis speaker join us. And so it's going to be interesting. I'm actually going to make a Zoom call with him maybe next week just to see what we're going to talk about. And, just it's going to be very interesting. I know with hypnosis, it's supposed to help, like with cigarette smoking and, weight loss. And I think it's supposed to help with chronic pain as well. So let's see.
Should be interesting.
Should be interesting. That's right.
Yeah. Well,
So
thank you.
you're welcome, and you guys stay safe and well, and we'll see you guys on the 27th. Oh,
Cheryl, I meant to tell you, thanks for the card.
You're welcome.
Yeah, it was very nice. Even I told Cindy, even my husband said, wow, that's really a nice card. So
You're welcome.
I think he really appreciated it. It was more his loss, but it was a loss for both of us, of course. But anyway, thanks.
Oh, no
You're
problem.
welcome.
Okay.
We'll talk soon.
Okay.
Okay.
Bye,
Thanks,
everyone.
Sonny. Thanks, Ron.
Good night or goodbye.
Bye.
See you later.
Bye.
Bye.